With all these new medicines and devices coming out constantly, it feels overwhelming, doesn't it? Health technology assessment, HTA, is key, we know that. But trying to get a standard way to evaluate them across, well, all of Europe, that sounds like a massive headache. So today, we're doing a deep dive into the European Network for Health Technology Assessment, EUnetHTA, for short. Their whole mission was basically trying to sort out that exact complexity, to create some shared understanding where, honestly, things were a bit all over the place before.
Right, and what's really interesting is how they took the basic idea of HTA, which, as EUnetHTA defines it, isn't just about does this drug work? It's
Yeah.
much broader. It's this multidisciplinary look at the medical side, sure, but also the social, the ethical, the economic impact. So, not just effectiveness, but costs, real benefits, ethical issues. Can we even implement this? And EUnetHTA really grasped that this big picture assessment needed a common language across Europe. Otherwise, it's just hugely inefficient.
Yeah, I can just picture it. You get some amazing new cancer drug,
Yeah.
and before EUnetHTA, you'd have maybe, 20, 30 different countries all spending time and money assessing the exact same thing
Yeah.
independently.
Exactly. A monumental waste of resources.
And critically, delays getting treatments to patients who need them.
Precisely.
So EUnetHTA gets 64 partner organizations together between 2006 and 2008. That sounds like a diplomatic miracle on its own.
It really was a huge undertaking.
What was the biggest hurdle? Getting all those different groups, different countries, to actually agree on one way of doing things?
Well, I think the shared goal was strong, but the biggest challenge was probably cultural. Getting national bodies to trust a shared framework instead of their own tried and tested, even if duplicated, methods. But their strategy was quite smart. They didn't just propose abstract ideas, they actively developed practical tools. That was key. Things to help create that common language. They looked at everything from just informing people about new tech to building up HTA skills in countries that maybe didn't have strong systems yet. It really did build a solid foundation for working together across Europe, kind of like creating a shared assessment engine.
Okay, so that's where the really concrete stuff comes in, like the HTA core model. That sounds fundamental to building that common language you mentioned. How did that model actually make things work on the ground across Europe?
Oh, absolutely central. The HTA core model was, a game changer. It's essentially a standardized template for doing assessments. It breaks down the whole evaluation into 9 key areas or domains. Things like, let's see, the health problem itself, a detailed description of the technology, safety, effectiveness, naturally costs, but also the ethical side, organizational impacts, wider social stuff, and the legal aspects too, 9 domains. And within those domains, they define between 133 and 153 specific things to assess standardized elements depending on the tech. That detail meant that whether you were assessing in, say, Sweden or Spain, you were asking the same core questions, looking for the same kind of evidence.
So reports could actually be shared and understood elsewhere.
Exactly. Shared, adapted, trusted. It cut down that duplication dramatically.
And you mentioned other tools, too. There was an adaptation toolkit, right, for using existing reports in new places.
Yes, that helped countries adapt reports from elsewhere to their own context.
But also this web-based toolkit for access with evidence generation. Now that sounds intriguing. Getting new tech to patients sooner. Can you unpack that a bit for us?
Sure. The Access with Evidence Generation, or AEG toolkit, tackles a tricky problem. What do you do with promising tech that isn't fully proven yet? It allows for a sort of conditional access. The technology can be introduced into healthcare systems carefully, while real-world data is systematically collected on how it's actually performing, its safety, its impact.
So like a learning phase in the real world.
Pretty much. It's a learn-as-we-go approach. It gets innovations to patients faster, potentially, but under really close watch. Safety and effectiveness are monitored continuously after it's on the market.
Is that toolkit publicly available?
It is, yeah. You can actually find it online. The site is eifel.eunetHTA.sante.ss.
Okay, good to know. So stepping back then, what EUnetHTA put in place feels pretty foundational for how Europe looks at health tech now. This quiet work behind the scenes, creating the shared blueprint. For you listening, this more streamlined, collaborative way of assessing technologies, it really does shape what treatments, what innovations become available. Makes you wonder, doesn't it? How will this ongoing effort built on that EUnetHTA foundation continue to shape our access to quality healthcare in the future? It's quite a legacy they started building.